North Richmond Community Health Podcast. I begin today by acknowledging the traditional custodians of the land on which we're recording this podcast, and I pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples listening today. When someone experiences an overdose, and that's assuming they're fortunate enough to have someone nearby, they only have a short time to recognise the symptoms and respond. And in many cases, nobody helps before it's too late. This is due to a couple of reasons, which we'll find out about later. But for now, in support of International Overdose Awareness Day, this episode will cover a little-known medication called Naloxone, which can temporarily reverse an opioid overdose. Whereas Naloxone was traditionally given as an injection by someone with a prescription or someone with medical background, now it's as simple as inserting a spray into your nose. This means that everyday people like myself, who have no medical training, can easily administer it to someone who has an overdose on opioids. In this episode, I'll speak with community members of North Richmond, and they've been in the area for up to 30 years. They now carry Naloxone and have had the training for free, which was provided at the Medically Supervised Injecting Room, otherwise known as the MSIR. They speak about some of the challenges they've had in the past when they've witnessed an overdose, and they also speak about how carrying Naloxone has ultimately affected their outlook and hopes for the community. But first, I'll talk to Chris. He is the Proactive Overdose Response Initiative Coordinator at the MSIR. He'll speak a bit about overdoses in the general community and also about how Naloxone works. Okay, let's do it. Can I ask you your name?
Chris.
We haven't actually explained exactly what Naloxone is. Can you give us a little primer on that?
Well, Naloxone it's a temporary way of reversing the effects of opioid drugs. Kind of like a temporary antidote, for want of a better word. It's not an alternative to calling 000 because it doesn't last a long time. And basically what it does is if someone has had too much of an opioid drug or too much of a combination of drugs, and more people are using more and more drugs is what's showing up in the data. And the opioid drugs attach to receptors in their brain, which is like a switch, and the switches switch on, and you get physiological changes like the heartbeat slows down, breathing slows down, that kind of thing. And if you have too much, that breathing can become dangerously slow, or it can stop altogether. And what Naloxone does is it pushes the opioids off those receptors, switches them off, blocks the opioids getting back onto them, so you can start breathing again. But unfortunately, it will wear off quicker than the opioids will wear off. So it buys you time, really, for an ambulance to turn up. We want people to call 000. It only works on opioid drugs. So it'll work on heroin, morphine, methadone, oxycodone, endone, that kind of thing. And while people often think about overdose being a heroin thing, we know that pharmaceutical opioids are the real issue here. Not to say that heroin isn't, but pharmaceutical opioids are. So it'll work on all of those drugs. It won't work on things like benzodiazepines, alcohol, that stuff. However, if you've taken a load of oxycodone because you're in pain and you get that from your doctor, you get something else from a specialist, you like a few drinks at the end of the night, or you use drugs illicitly, and you overdose, taking the opioids out of the picture temporarily might be enough to get you breathing again. So it does nothing else. I mean, you can't get high in it. We actually tried once to talk to people about how you could misuse it, if you possibly could, just so we could be prepared. And I think the only thing they come up with is that if you really didn't like someone, you could wreck their buzz. Do you know what I mean? So it's really... Yeah, so it does nothing else. You can't get high on it. I could be giving you Naloxone all day long, and if you weren't on opioid drugs, it's going to do nothing to you. Do you know what I mean? So it's a really, really safe medication. Yeah.
And for people in the community, what does it mean for people to have access to naloxone?
I mean, everyone's a lifesaver now, you know. What you find, I think, is you get a lot of people with, say, family members or friends or something like that they're at a risk of overdose. Now, that people automatically think illicit drugs, but like I said earlier, you know, you could be on prescription medicine that's prescribed to you. Do you know what I mean? And you might be at risk. A lot of people feel quite helpless. You know, they don't know what to do. What can I do? My loved one is there. This is something they can do. They can carry Naloxone and they could potentially save a life.
Are there any issues in the way for people to access Naloxone? Are there any barriers?
Well, you can get it at a pharmacy now if your pharmacy is registered to provide it. It's free at a pharmacy. Now, one barrier is your pharmacy mightn't stock it. You know, that could be an issue. The Victorian government, through the Department of Health, has been trying to make Naloxone much more freely available by having needle and syringe program workers be able to dispense it directly to clients. There's been a few hold-ups with that program going through, but we're hoping that it happens soon. I think one of the biggest issues is a lot of people don't know about it, and a lot of people don't think that they're at risk of overdose. Do you know what I mean? I mean, if you talk to Nana, who's, you know, getting painkillers from her doctor, like I said, and she likes a glass of port at the end of the night, she's at risk of overdose. But if you said to her, you're at risk of overdose, she'd be like, well, I don't take drugs. Do you know what I mean? But she is so often it's for people that don't see themselves as drug users, it's probably more helpful to use the term opioid poisoning, you know, because that's effectively what it is. Yeah, I reckon if you're getting painkillers or any kind of medication from your doctor, you should speak to them. Or if you've got a loved one that's getting that, speak to them. Find out about the medicine.
So is there a difference between the training you provide and the training a pharmacist provides?
Well, a pharmacist will show you how to use the Naloxone, but they're probably time constrained and they'll just be very straightforward with it. But if you came to me and you said, look, I want to get Naloxone because I have a friend that I'm really worried about, we could not only teach you about Naloxone, we could give you other information, give you access to services. We could do all sorts of other things to help you as well.
International Overdose Awareness Day is coming up on the 31st of August. What do you think people should be thinking about, and is there anything they should be doing or they could be doing?
Well, you know that Overdose Awareness Day started in Melbourne, actually, 20-odd years ago. It was started in St Kilda, believe it or not, and it was a small get-together to remember people who had died of overdose. And now it's a global thing, it's huge. I think a really, really important thing would be to carry Naloxone. Have a look on the Overdose Awareness Day website, see if there's local events that you could attend. They're all over the place. We're going to have events here at North Richmond Community Health. If you want to come down, you'll be more than welcome. If you have friends or family that, even if it's from a doctor, they're getting medicine, find out about the medicine. And carry Naloxone. Let her out to use it. Takes a few minutes, you can be a lifesaver.
Since the inception of the MSIR in Victoria, there has been a notable rise in awareness regarding the multifaceted social challenges and strategies for minimising harm within the North Richmond community. I spoke to a few community members about the experiences that led them towards carrying Naloxone as a crucial tool in their lives. And just a content warning ahead, there will be descriptions of overdoses which may be disturbing to some listeners.
I'm Judy Ryan and I've been a local resident for 11 years.
I'm Tanya and I live on York Street nearby and I've been a resident for 8 years. I'm Elizabeth. I also live on York Street. My family's been in the area since 1977.
Judy, can you explain a bit about the work you've done in the community?
I've been involved in the community campaign for the MSIR from 2016. We started campaigning for the facility due to the neglect of our area and people with addiction who are overdosing and dying in the streets. The ambulances that were clogging up laneways and pathways and roadways, and the sound of sirens in the area. So it was a very distressing place to live, and people were dying and needed our help. So, and I've been involved in the neighbourhood since then. Actually did naloxone training about 5 years ago with the syringe, which I found a bit daunting. So when the new nasal spray option came up, I was really impressed by that. And so when an opportunity came to be trained by the MSIR staff, I was very happy to do that and to invite my fellow neighbours to come along as well.
So Elizabeth and Tanya, you've both done the training. Can you tell us a little bit about why you decided to do the training, and have you ever had to use it?
So I have a brother who's had a long-term addiction and am very much aware of what he went through when he was using and his fear of overdosing. And so I have an interest to do as much as I possibly can to assist people who may take an overdose. But given now that these new sprays are around, it makes it so much more easy to administer, but also through our training, we were taught methods of delivering doses and keeping ourselves safe. So I feel very comfortable to use it now. I haven't had an opportunity to use it, given it was only a few weeks ago, but I have a naloxone in my work briefcase that I take to work every day, and I have one in my handbag that I use around locally. So if I need to use it, I feel confident enough now to use it after 5 minutes of training. Yeah, very impressed.
Yeah, my experience is somewhat similar to Tanya's. I've had a couple of occasions where I've had to call an ambulance, one of those before the MSIR was established, and that was really, really frightening and confusing and confronting, all of those things. That happened on a day, was quite a hot day, and we had interstate visitors had just turned up, and I heard someone yelling outside on the street, and there was a young man who was almost blue at that point, and his partner who was really upset and whatever. We called the ambulance, but in the meantime, there were builders across the road and somebody had to try and give him mouth to mouth, and I was on the phone on my mobile, and there were quite a large number of people trying to help. But if we'd had Naloxone, it would have been so much easier. And I mean, I'm still feeling kind of upset about that incident at the time. And a few months ago, I also had to call the ambulance for someone, and that was over near the Hive. And it was night, so I couldn't really see his skin that well, but I believe that he was also kind of on the point of turning blue. And I ran to get the, the defibrillator from the chemist, but that took quite a while as well because first people didn't know where it was. And, you know, I have had training in using that, but, you know, I wasn't sure whether that was the right thing to be using at that time. If I'd had Naloxone, I would have just used it straight away. You know, I think it's a simple question. Are you willing to get involved? Are you willing to help or not? If you're willing to help, what have you got to help with? And this makes it so much easier, I feel.
You raise a good point, because a lot of people, when they pass someone who appears to have passed out and they hear the deep snoring, they think they're just going to sleep it off, when in reality the respiratory system's shutting down and they don't know how to help someone who is going through an overdose. Judy, anything else to add?
Look, I think what Tanya and Elizabeth have said is absolutely spot on. I think the other thing that comes across too, it's not just about saving lives, which is key, but also about reducing the possibility of people having brain damage. And that is a really big issue as well. So the longer they're without oxygen and being able to breathe, it's really impacts their brain, you know. I just encourage anybody to do it. And even as our trainer said, you know, it might be people with multiple, it mightn't just be people with heroin around this area, but, you know, family and friends have, you know, concoction of drugs on them, you could use it then. And if you use it and they don't have that issue, it's not a problem. So I just think it's a bit of a no-brainer, really. And the fact that it's free from pharmacies is just, and you get a box of 2, is fantastic.
We were also told that there are no legal issues with carrying it or using it. So, you know, some people might hesitate for that reason, and I think that's something that you don't actually need to worry about.
I appreciate you taking the time.
Thank you.
Thank you.
If you want to access naloxone and naloxone training and you live locally in North Richmond, you can contact the Alcohol and Other Drug Program at North Richmond Community Health. And the phone number is 94189811. And you can reach out to the Proactive Overdose Response Initiative for further information on overdose response and naloxone training. If you live in other parts of the state, you can call Direct Line, where you can ask about your local naloxone provider. That number is 1800 888 236. All providers give training as a free service, and the naloxone itself is free as well. As we finish up this episode, I wanted to remember the significance of International Overdose Awareness Day. It serves as a powerful reminder of the lives affected by overdoses. By fostering compassion and understanding and sharing this information, we can work together towards preventing future tragedies. Thank you for joining us in this important conversation.